Hey everyone, Right at Ego here, and I'm going to give you an intro into anatomy and physiology. In this video, we're going to discuss the planes of the body and a few directional terms. For me, having visuals help me remember terms and to use them properly. I hope you're ready. First term here is mid-sagittal plane. And for me, it's thinking of Two-Face here from Batman. Is a great representation. The mid-sagittal plane cuts a person right down the center, vertically, separating them from the left and the right side of the body. As you can see here, it goes straight down his nose and keeps down to the what's called midline or middle of his body. This next one may still be Two-Face, but as you can see, there's more human sight and no longer on the midline. This makes the plane parasagittal. So as you can see, there's about 90% or so more of the human side versus the disfigured, which is what makes it parasagittal. In the frontal plane, this is where you cut someone vertically in half, separating the front side from the back. For me, Jadzia Dax from Star Trek comes to mind as a good representation of the frontal plane. She may not be an exact frontal plane, but as you can see that the spots, it would cut her in half vertically, front from back. The transverse plane is cutting someone in half vertically, separating them from top and bottom. I think of the old magician trick of sawing someone in half. Now the next one isn't normally talked about this early and doesn't really get seen until cardiovascular system. This plane is the oblique plane. It isn't sagittal and it's not transverse either, but it's a diagonal cut. So if you were to draw a straight line where that piece of lightning bolt is missing, it would make a diagonal cut, which is how it's oblique. Now, moving forward onto the anatomical position. This is feet flat and palms outward with arms to the side. When it comes to the directional terms that we'll be talking about here in a second, it's referring to this anatomical position as to where things are. First term is superior, which means above. An example of this is the clavicle is superior to the ribs. Inferior means below. The tibia is inferior to the femur. Anterior or ventral means in front of. The heart is anterior to the left lung. Posterior or dorsal means behind or back of. The spine is posterior to the ribs. Distal means further away from specific area. The hand is distal to the shoulder. Proximal means toward the point of origin. The elbow is proximal to the wrist. Lateral means to the side or away from midline. The ears are lateral to the nose. Medial means toward midline or center. The chest is medial to the arm. Bilateral means it affects both sides. Bilateral arthritis affects joints on both left and right sides of the body. Unilateral means it affects one side of the body. The accident that caused Two-Face was a unilateral accident. Ipsilateral means on the same side of the body. The right arm is ipsilateral to the right leg. Contralateral means the opposite side of the body. The left brain contralaterally controls your right limbs. Well, I hope you all enjoyed dipping your toes into anatomy and physiology. There will be more to come. Stay tuned.